Hi, wish you all good day. Hope my sound is clear. This is a question discussion session. We can start practicing questions. Hope my sound is clear. Okay. So this is the first question. Here the question is to reduce the risk of transmitting methicillin resistant staphylococcus aureus, that is MRSA. Fine. So from an infectious wound, which of the following precaution should be implemented? Okay. So here a client is diagnosed with MRSA. So in order to reduce the chances of transmitting MRSA, what is necessary? Okay, so this is a question from infectious disease. Clear? So you should understand that usually MRSA get transmitted through which route? Mode of transmission of MRSA is very important. MRSA usually get transmitted through contact. Fine. So we have to follow contact precautions in order to prevent transmission of MRSA. Okay. So what is the answer for this? It's contact. Okay. So when you get questions from infectious disease, you will get different other diseases and how do we take measures or what kind of measures are taken in order to prevent getting transmission of these kind of infections. Okay. So one is MRSA. Same these kind of questions will be asked. Okay. So please write it down. See, while attending this class, please keep your notebook in front of you. Please write it down. Meningitis, normal meningitis. Usually when you get a question like a client is admitted with pneumococcal meningitis, meningococcal meningitis, so the mode of transmission would be droplet. First note what you need to write is MRSA, mode of transmission is direct contact, meningitis, droplet, chickenpox, airborne and contact. I repeat, chickenpox, airborne and contact, measles, rubella, airborne. Please remember, measles is otherwise considered as rubeola and rubella is otherwise named as German measles. Fine. So other name please remember. Okay. And pulmonary TB, airborne, influenza, droplet. I want you all to just write it down. Okay. So these are the questions frequently asked. Again, corona, you know, like it is airborne. Nipah virus, airborne. Ebola, it get transmitted through contact as well as droplet. Clear? So at least these many, please remember, you will get questions. Fine. So this is a question from infectious disorder based on mode of transmission. Okay. So always remember that when you get these kind of questions, first of all, mode of transmission is also, it is very important to remember. And to prevent these kind of infection, what kind of precautions that you need to follow. Okay, clear? Hope it's clear. We'll move to next question. So here you can just read the question here. A 10-year-old girl present to the emergency room, fine, with pain. On assessment, you noticed that when you palpate the quadrant, that means here I would say it's left quadrant of child's abdomen, the child feel pain on right quadrant. Okay, so you just started palpating on left side and that is causing pain on right side. So which of the following sign is named as? Okay, So here a client with a pain, 10-year-old girl with pain on assessment. When you palpated on the left quadrant, lower quadrant, then what happened? The child complains of pain on the right quadrant. When you applied pressure on the left, it made pain on the right side. Okay, so this is a sign of appendicitis. Okay, so always remember that if there is a pain on right quadrant, okay, if it is like a right lower quadrant, it's not specifically mentioned in the question, but still you need to understand if the pain is on the right lower quadrant, that will be a sign of appendicitis. Okay, there are basically two signs usually we assess it to confirm appendicitis, that is rebound tenderness on the right side and the other is Rovsing sign. Okay, number one is rebound tenderness, number two is Rovsing sign. So please write it down. Rebound tenderness is a method or it is a sign usually we assess by palpating on the right side. Remember, when you palpate right lower quadrant, if it is causing pain on right side itself, when you keep the hand on right lower quadrant, the child is having pain. That is indicating rebound tenderness. Fine. And it is a Rovsing sign. There is a spelling error. When you palpate on left lower quadrant, if that is causing right lower quadrant pain, if you palpate left lower quadrant, if that is causing pain on right lower quadrant, it is considering as Rovsing sign. So in this particular question, the answer is C. And McBurney sign, where the pain will be on the McBurney's point, that is also a sign of appendicitis. Okay, but better when you consider all of this, the better answer is C. And also when you get a patient who is having the symptoms suspected to have appendicitis, the confirmatory method where you need to just confirm the diagnosis, that can be confirmed by doing Rovsing sign. Why, you know? Instead of palpating on the same side, if you palpate it on the opposite side, that will be really safe, because when you palpate continuously on the right hand side, it sometimes may end with a rupture. So I don't want my patient to be in a unsafe situation. So always frequently if you want to do, then it would be always better to do Rovsing sign. Clear? And the last one is the obturator sign. That is also a sign associated with the appendicitis. Whereas in obturator sign, that will be usually assessed by making the patient to lie down in supine position. And then you need to just flex the knee. When you flex the knee, it causes pain. Okay, but that is also not surely considering, or it is not considered as the most appropriate way. Here in this particular question, how did an examiner performed the physical examination, that is specifically mentioned. So based on the situation, the correct answer is Rovsing sign. Clear? So please remember what is Rovsing sign, what is right rebound tenderness. McBurney's point sign is also related to appendicitis. Even obturator sign is also associated with appendicitis. Clear? So this is a question related with appendicitis. Please remember that appendicitis sign is pain where it is on right lower quadrant. Clear?